welcome to our telehealth medicine safety information video. I'm Garvin, and this video is on Palexia. So what is Palexia used for? It's a standard tablet or liquid used for the short-term relief of moderate to severely acute pain. For example, pain following an operation or injury. Prolonged release tablets are used to relieve chronic or long-term moderate to severe pain. For example, osteoarthritis, lower back pain, nerve pain, or pain in cancer. Some key points to know about Palexia. Palexia, or the chemical ingredient in it, Tapentadol, is suitable for adults aged 18 years of age and over. It's sometimes prescribed in hospital for children aged 2 years and over. That's only hospitals. Palexia tablets are usually taken every 4 to 6 hours. Palexia SR tablets, or the slow release tablet, are taken every 12 hours. Palexia can be addictive, but addiction is rare when it's taken as directed by your doctor to relieve pain. So the most common side effects of Palexia are headache, feeling sick, dizzy or sleepy. Don't drink alcohol while taking Palexia. So how does Palexia work? Palexia is a strong opioid painkiller, and strong painkillers like Palexia relieve pain by mimicking the action of naturally occurring pain-reducing chemicals in the body called endorphins. Endorphins are found in the brain and spinal cord and reduce pain by combining with opioid receptors. Palexia mimics the action of our natural endorphins by combining with the same opioid receptors in the brain and spinal cord. This blocks the transmission of pain signals sent by the nerves to the brain, and means that even though the cause of the pain may remain, less pain is actually felt. So Palexia also enhances the activity of a neurotransmitter called noradrenaline in the brain. So neurotransmitters are chemical compounds that act as messengers between the nerve cells. Enhancing the effect of noradrenaline also helps relieve pain. So is Tapentadol addictive? It is possible to become dependent on Palexia if you take it for a long time, but this is not usually a problem because withdrawal symptoms can generally be avoided by reducing treatment gradually. Palexia is not suitable for people with very slow and shallow breathing, so respiratory depression, and people with severe asthma who are having an acute asthma attack. Also not suitable for people with inactivity in the intestines causing severe constipation or a blockage in the gut, and people under the influence of alcohol, sleeping tablets, painkillers, or medicines or drugs that affect mood and emotions. It's also not suitable for people with raised pressure inside the skull, so raised intracranial pressure. Also people with reduced levels of consciousness or who are in a coma, and people who have taken a monoamine oxidase inhibitor antidepressant or an MAOI in the last 14 days. Can you take Palexia while you're pregnant or breastfeeding? So if you think you could be pregnant, you should get advice from your doctor before taking Palexia, because its safety during pregnancy has not been established. Palexia is not normally used during pregnancy unless it's considered essential by your doctor. It is not recommended for use during labour or delivery because it may cause breathing difficulties in the baby after birth. It is not known if Palexia passes into breast milk, but should not be taken by women who are breastfeeding. So if this relates to you, get further advice from your doctor before you start breastfeeding if you're on Palexia. All forms of Palexia can be taken with or without food. So how do you take Palexia tablets? Palexia's standard tablet start to work quickly and their effects wear off after a few hours. They may be prescribed to take only when needed to relieve pain or on a regular basis, depending on the cause of your pain. The usual dose is 50 milligram tablet every 4 to 6 hours. If you still have pain, your doctor may increase your dose up to a maximum of 600 milligram in 24 hours. Always follow instructions given by your doctor. And how do you take the Palexia SR tablets? Palexia SR tablets are taken every 12 hours. The dose prescribed by a doctor will depend on how severe your pain is. Whether you have previously been taking other opioid painkillers and various other factors, do not take more than the prescribed dose. Palexia SR tablets must be swallowed whole with a drink of water, so you do not break or crush or chew them, as this will cause the whole dose to be rapidly absorbed into your body, which could result in an overdose. Can you drink alcohol while taking Palexia? So no, it's best to avoid alcohol. Drinking alcohol with Palexia will make you more likely to feel sleepy, dizzy or confused, or get other side effects like blurred vision. Can you drive while taking Palexia? So in some countries it's an offence to drive while you take Palexia. So do not drive if you think it affects your ability to drive safely. For example, if it makes you feel sleepy, dizzy, confused, unable to concentrate or make decisions, or if you've blurred or double vision. So the main side effects of Palexia, as I just said, feeling sleepy, dizzy, headache, feeling sick or vomiting, decreased appetite, anxiety, confusion, hallucinations, abnormal dreams, tremor, muscle spasms, constipation, diarrhea, indigestion, dry mouth, rash, itching, sweating, feeling weak or tired. So can you take other medicines with Palexia? So first of all, painkillers. It's fine to take non-prescription painkillers like paracetamol, ibuprofen or aspirin with Palexia, assuming they're appropriate for you. These are weaker painkillers, but as they work in a different way, they can attack your pain from a different angle. So antihistamines, if you need an antihistamine, it's best to go for one that won't make you sleepy. So for example, cetirizine or loratadine. You shouldn't take Palexia if you have taken a monoamine oxidase inhibitor antidepressant. There's a MAOI antidepressant. For example, the antidepressants phenelzine, tranlycipramine, or isocarboxide in the last 14 days. You're more likely to feel sleepy or have breathing problems with Palexia if you take it with other medicines that can cause drowsiness, such as antihistamines that cause drowsiness, hydroxyzine, promethazine, the antipsychotics such as haloperidol, barbiturates such as phenobarbital, benzodiazepines like diazepam, temazepam, and gabapentin, sleeping tablets like salpiclone or zimovane, to tricyclic antidepressants like amitriptyline. There may be an increased risk of a rare but potentially serious side effect known as serotonin syndrome if you take Palexia with medicines or drugs that increase the levels of activity of serotonin in the nervous system. These include the following: duloxetine and mirtazapine, selective serotonin reuptake inhibitor antidepressants such as citalopram, escitalopram, fluoxetine, fluvoxamine, paroxetine, or sertraline, serotonin noradrenaline reuptake inhibitors such as venlafaxine or duloxetine, and the tricyclic antidepressants like amitriptyline, and triptans for migraine such as sumatriptan. If you're taking any of these medicines, you should tell your doctor if you experience symptoms such as confusion, agitation, tremor, muscle twitching, shivering, sweating, racing heartbeat or diarrhea after taking Palexia as well. So that brings this video to an end. If you have any questions, you can leave them in the comments below or contact us through our website mytelehealth.info or call into Lynch's Pharmacy, Douglas, Cork, or ring 436 6923 to find out more. Thank you for watching. Stay stay healthy and stay informed.